and other stalwarts in that field of AI who are here and झंडा गाड़ के बैठे हुए हैं AI का. So thanks a lot. You guys are doing really inspiring work, especially Rakesh boss, and also Bharat boss is not here, and Alok Modi sir is also, he was here. I don't know where he has gone. So my journey started with AI before the advent of LLMs. In 2021, I helped founded a health tech company called as Eka Care. And in that journey, we built a lot of AI tools. I will be talking briefly about them, and I will be also showing you some things on the live. That's why I have my own laptop here. So the idea here is that the topic given me to was around routine admin tasks and clinical decision support with AI. But the fact of life is that a lot of AI tools are there for automation. We clinicians don't understand them, how to use it in our day-to-day practice. So frankly speaking, the use cases are not clear. Even to me, it's a challenge. When I practice, a patient sits in front of me, I am totally focused on examining him and telling him what needs to be done. And I forget about what AI will do and what AI will not do. But beyond this kind of actual scenario, there is a need to understand how the world is moving and what are the probabilities, basically, which we are not even looking at. And this disclaimer again, I'm saying I'm not promoting Eka Care, but because I have worked into it, the journey and those things, I will be showcasing those things predominantly. Secondly, my talk will not be very presentation specific. I will show you actual how I am doing or using things on real life. So basically, what we wanted to show is how to automate routine administrative tasks, enhance clinical decision support, learn from Indian success stories, understanding ABDM integration pathways. So basically, ABDM is important because if you don't know ABDM, you will fail to understand the regulatory environment. So ABDM, or the Ayushman Bharat Digital Mission, is setting the stage how the government of India is going to regulate all this health data as part of its health data stack. So any software or any app, if it is not ABDM compliant in the future, will not be able to survive in the market. So please bear that caveat in the mind. So just some context, the Indian private clinic landscape, around 65% private clinic share is there, 75% solo practitioners, 1 to 2 hour time goes into admin task. The administrative burden is a reality, there's a time drain, and 75% private doctor side administrative workload is a major cause of reduced patient. It's part of the studies. I'm not going into the detail. Clinical demands and rising burnout, again, patient volume ranges between 30 to 100 in a good OPD, time pressure is there, and patient expectations are also that wants explanations, they want second opinions, detailed prescriptions are going mainstream, but still only, frankly speaking, only 3% of the, you can say, clinics or prescriptions are datized as of now, and there's a big gap in our, you can say, journey to datization of health in India. So obviously there are manual workflow or pain points. We all understand that appointment is a chaos, missed calls during consultations, double bookings, no-show rates, WhatsApp messages are overloaded, documentation backlog is there, eligible handwritten notes are there, post-clinic EMR data entry happens. Even in the government setting, doctors are not generating detailed prescriptions. In fact, the staff has been deployed to kind of do the EMR entry. And obviously, because of that, there's a financial strain, and insurance claims also suffer because of that. And there's an error-prone billing, cash flow unpredictability, and all those stuff is there. So before going to that, so what are the solutions? So some of the solutions are very, very straightforward. You use an EMR, EMR does a lot of work for you. Second is, how can AI get into that? So I will give you some examples. So first is an Eka Scribe. Eka Scribe is transforming clinical documentation. What it is basically a speech to text engine. And what it does, by the time a doctor interacts with a patient, it will convert those conversation into, say, a clinically structured ABDM compliant format, which can go directly into your prescription pad. So let me just show you a small video right now, and this will demonstrate what exactly we have built.
Did you know that doctors in India spend up to 60% of their time just writing prescriptions and recording notes? Now imagine if we could give them that time for what truly matters. Listen carefully. Introducing Eka Scribe, an AI-powered tool that listens, understands, and transforms doctor-patient conversations into accurate digital prescriptions in real time. This is the new age of consultation. Let's take a look at how this works.
तो बताइए क्या हुआ आपको? तो पिछले 2 हफ्ते से मुझे बहुत ज़्यादा खांसी है और साथ में सर्दी भी है
बुखार उतरता चढ़ता रहता है, लेकिन यही हो रहा है 2 हफ्ते से।
खांसी जो आप बोल रहे हैं बहुत ज़्यादा बलगम के साथ आता है या इज इट ड्राई कॉफ?
नहीं, बलगम के साथ आता है, थोड़ा सा येलो कलर का बलगम रहता है।
ओके, ठीक है. Any family history among ಅಪ್ಪಗೆ ಏನಾದರೂ ತೊಂದರೆ ಇದೆಯಾ?
ಮಮ್ಮಿಗೆ BP ಇಶ್ಯೂಸ್ ಇದೆ, ಪಪ್ಪಂಗೆ ಶುಗರ್ ಇಶ್ಯೂ ಇದೆ, ಡಯಾಬಿಟೀಸ್.
Do you have history of asthma?
No, I don't have.
Okay. ಇವಾಗಲೂ ಸ್ವಲ್ಪ ಟೆಂಪ್ರೇಚರ್ ಇದೆ. It's come around 100 degrees. Let me just check your pulse. Once again.
So you can see that the agent is basically noting down in the background.
Mostly like a basic viral illness, upper respiratory tract. So I'll give you a course of medication for 5 days. वो आप ले लीजिए एंड उससे अगर कम नहीं हो रहा है, let's just get a chest X-ray done.
Okay.
And a basic allergy profile also done.
Okay.
आपको कोई ड्रग एलर्जीज ऐसा कुछ है?
हाँ, मुझे ट्रामाडोल और सल्फा ड्रग से एलर्जीज है.
Okay. Do you smoke or consume
No,
alcohol in any
I
form?
don't.
Okay. And for cough syrup, we'll just change it to ascoril expectorant. ಇದ್ರ ಜೊತೆ ಏನಾದರೂ ತುಂಬ ಫೀವರ್ ಸ್ಪೈಕ್ ಆಗ್ತಾ ಇದೆ ಇಲ್ಲ उसिराटक ತೊಂದರೆ ಆಗ್ತಿದೆ और अगर आपको
So it's
चलने में
multilingual.
दिक्कत हो रही है, बहुत ज़्यादा तकलीफ हो रही है, तो you can come back to clinic. ठीक है? Okay. Okay. So this is what my consultation was, and once I'm done, I have to just click on yes, I'm done. And we need to give the system a few seconds to generate the output. And as you could see, this consultation included multiple languages, Kannada, Hindi and English. Let's see how the output of the scribe comes. Here we go. So the notes are ready. There are 2 sections, EMR pad and clinical notes. As you can see, the EMR pad has all my key sections, lab results, symptoms, cough with yellow phlegm, which was told by the patient in Hindi, has gotten beautifully captured in my medical language, the patient history with current medications, her drug allergies, her family history, the medications, everything has been documented in a very nice structured manner. And all I have to do is click on copy to Eka EMR pad. But there is a different use case. You don't always use an EMR pad, let's say. For those cases, there is also something called clinical notes. But before we go there, we can see how advices have also been captured, and there is prescription notes for anything which doesn't fit into our regular RX pad structure. So here are the clinical notes, right? This is a more detailed transcription of the entire consultation with clear headings around the plan, clinical findings and other instructions. So if I'm not using an EMR, I have to just click on copy to clipboard. But in my case, I'm using an EMR, and the minute I click on copy to my EMR, as you can see, all the right information has been filled against the right sections, be it medications or lab results or the advices that was given to the patient, with extra notes which can be edited. And just before sending it across to my patient, I have to just review it, and clearly there is no additional changes I want, and there is an instant digital prescription created from that consult. So it is that easy. So you can now see the powers and potential this kind of technology has.
So basically what has happened is that the patient was conversing full time with the patient. There was no kind of interference from anybody, and the whole conversation was recorded, transcribed and converted into a medically codified language which went directly into the EMR. So this is the power of AI, and it is not something which is in future, it is happening right now in India, and we Indians have built this product. Second is when we talk about, so coming to the back to the presentation, so AI powered appointment management, I will show you something this as well. So let's go to, say for hypothetically, this is the Apollo Hospital's website. So generally what happened till now, we used to go to the book appointment section and we used to book doctor's appointment from here. But now what we have done, we have built an AI enabled chatbot for Apollo Hospitals. This is built by our team. And now it is basically an AI enabled chatbot. Now what it is asking is, so basically it is giving you some ready-made prompts like help me find a doctor. So suppose I want to find a diabetologist. So I will type help me find a diabetologist. So all this is live. You can also go and you can check the website. So basically it's a bit slow because I'm using my mobile data set or data point. So basically it is now asking which city you are located in. So now I am putting it Noida. So now it has given me two ready-made options and also showing me available slots, and I can directly book from here. This is the power of AI, and it has gone live with Apollo Hospitals, again built by our team. Automated bills and claim processing, I will not go into that because it's more of hospital specific, not of interest to our day-to-day physician practice. AI powered paperless records was driven documentation, I already showed you the example. Transformation before and after AI, it's self-explanatory. Now coming to CDSs. So basically when we talk about CDSs, and Amit and Dr. Rakesh showed a lot of tools, I will show you something live out of my own, you can say, prescription pad. This is my pad, this is my patient. I'm going into it and I have got a, you can say, doc assist AI. So basically, to give you the context, it's a cloud AI model LLM, which has been integrated into this EMR pad. So the problem with us is that when we are practicing, we do not, or we are not able to use different tools just because it's not part of our workflow. When we are seeing a patient, we are seeing a patient. So, but with an integration into the EMR, what happens? Now I can ask questions and I can derive answers based on the patient history as well. So here the option is, I am taking the use patient data, and this is an old patient. She's coming to me since 2021 through the COVID wave, and she's a diabetic, old time diabetic, and she also has, you can say, anemia. So let me ask, what are the reasons of chronic anemia in this patient? So now I am not going into prompt engineering, I am not going into anything, I am writing a very simple prompt which just came into my mind, and let me see how it answers it. So now what it will do is, it will just go, it will dig into the patient data, will try to find out an probable answer for that. So now I am not vouching for the reliability, accuracy, all those stuff right now. I am just showing you or demonstrating you a CDSs in actual practice. Now this CDS is basically nothing but an AI or LLM integrated into your patient workflow. Now suppose I want this patient to be referred to, say, a nephrologist for a further kind of workup. So what I will do is, kindly make a detailed referral note for nephrologist review, and it will also help me generate that in real time, in a very short span of time. So as you can see, the whole summary has been generated, and also it has given me some kind of input around reasons for referral, although I can change that. So what I'm trying to tell you is that in real life setting, this is how CDSs works. Now another use case scenario. So I'm just trying to demonstrate use case scenarios which I have been able to figure out. Maybe you will be able to find more use case scenarios, but I am trying to show you what I have been able to find. Help me create a 1400 kilocalorie diet chart for this vegetarian North Indian female. So it will also help me generate a diet chart as well. So these are 2 or 3 use cases which I think LLM integrated into your EMR with, say, CDSs can do for you. So it has given me something like this, with a breakup of, say, calorie wise breakup of everything, and this I can share with my patient as well. So now coming back to the presentation. So why CDSs matters for Indian private clinics? Because obviously it has the potential to kind of bridge the skill gap. I won't say all these things, but basic thing is that in India we have got a skill gap. A physician finds it difficult to see a dermat patient. A physician finds it difficult to kind of diagnose sometimes because the case is complex. It has got multiple issues. So all these issues can be handled with the help of a proper CDSs. Now I would like to also show you something which Dr. Amit talked about, agentic AI. I will show you a real case example, and the reason why I'm able to show that is because, just a moment. Now we have got Comet AI, which is a browser developed by Perplexity. So now I will just expand this. So now again, I have opened the same EMR pad. I was using it in Chrome. Now I am using it in Perplexity Comet. Now there is an option called as Assistant. And while Amit was talking about agentic AI, I just experimented with it. And now I'm going to give it a command. Say if you look at my, so basically this pad, you can see there are 7 follow-up patients due today. So I am going to ask him, can you help me send follow-up reminder to these 7 patients due today. So now see the power of combination of an EMR with an agentic AI. It will just extract data from this EMR pad. It will use the features of the EMR pad to send a follow-up reminder to the patient, real time. And thanks, Amit, I just got the idea from your talk, basically. So it's kind of analyzing on its own. It is kind of expanded the follow-up list on the left side. I'm not doing anything. I am standing here. The agentic AI is doing it for me. It will do, it will do. Just wait and see. So actually, before coming on the stage, I tried it out. It had already sent 2 messages and then I stopped it. So actually it is also trying to work out what all the features are there in the EMI. It's trying to understand what is happening in the background and how it can utilize the power of all the features built in the EMR to kind of do this agentic AI work. Yes. I can do all those things. I'm just showing it that even without I'm not touching anything, this is what agentic AI means in real term practice and what are the use cases it can solve. So in the morning you come or you can kind of give instruction to your staff to do this and it will do it on your own. So step by step it has reached 3rd patient. So I will just stop it because it was for demo purpose only. So I'm stopping it for now. So this was basically for the demo purpose. I will again go back to where we were. हाँ वो तो we can do. So basically idea was not to go into that right now, so I'm not going into that, but again all these things are possible with the power of agentic AI. That's what I just wanted to demonstrate. Coming back to it, and I will just finish it off now. So AI is also being used for screening, diagnosis and management, like Nirama AI has got a screening for breast cancer, Cure AI for chest x-rays for tuberculosis, pneumonia, etc. Mitra for diabetic retinopathy. So all these tools are available. Medication safety and decision support, as I already told you, in Eka EMR also we have built kind of your say interaction reminder. You can say interaction reminder, contraindication, all those are inbuilt. We have also done another thing. We have used Indian specific clinical guidelines and we have used that as part of the CDSS process. So obviously there are a lot of benefits. Eka Scribe, how it works. So basically natural conversation capture is there, then context aware processing is there, structured node generation and EMR integration. These are the 4 steps through which the Eka Scribe works. This was the basically video link. So again we have got patient portal and mobile engagement. Again I showed you an example through Apollo Hospital channel also. And So triage and symptom checking, we have got an patient side app also where AI enabled symptom checker is there. So patient can already input their data and that data gets integrated with the EMR. So due to paucity of time, I'm not able to show that, already time is over. So again, as I said, ABDM ABA integration. In future, all the tools will have to be ABDM and ABA integrated. Every patient will have an ABA ID, and that's how the regulatory framework will work. And we have got government initiatives also. We have got eSanjeevani telemedicine platform. We have got AI screening programs, as I said, and PMJAY is also looking at AI solutions. There are some practical implementation barriers like initial investment, learning curve. Doctors are obviously not aware about the use cases. There are technical issues about system reliability and data security, as everybody said. In our system, what we have done, when you share, when you tick on the patient share data, it is not shared to cloud actually. So it is processed on your say cloud in India only, and it is sent back. So again, success strategies are start small with one system. Basically, start with smaller steps. Try to experiment. Try to learn on the go. Always choose NHA ABDM certified platforms, implement hybrid models, invest in staff training, and emphasize patient benefits in communications. So thank you. I think the purpose was just to demonstrate